I didn't know if I could make it because it's a high-paced area, and you really got to know your stuff, or it can cost someone their life.
Nearly 40 years later, they're still there, taking care of patients. Darlene Hill sits down with two of the first Black registered nurses at Grant Medical Center. Interesting story. Stay with us.
Well, they're nurses, friends, and trailblazers at OhioHealth.
And they met nearly 40 years ago after becoming registered nurses. Excited about embarking on their new careers, they were and sometimes still are surprised that some patients see color instead of their credentials.
Darlene Hill shares their story.
I used to even fix my doll babies when I thought they had a broken leg or broken arm. I was always trying to repair the broken leg or the broken arm.
And that little girl grew up and answered that calling. Yvonne, Cecil, and Sonia Booker both started at the Grant Medical Center as critical care nurses in the mid-1980s. Cecil says she worked every shift you can think of in ICU, while Booker was in the emergency room. They connected because of the other's professionalism and race.
I gravitated to people who looked like me because I felt so alone in many ways. And so gravitating to Yvonne and taking her lead in many things, even though we were the same age, came to Grant the same time, she still was a leader because she knew Columbus, and I leaned on her in so many ways.
That lean began 37 years ago. Back then, there weren't a lot of African-American registered nurses working at Grant Medical. In fact, Cecil and Booker were the only two for several years. Some patients took notice and were grateful.
There was a lot of African-Americans that would come for treatment and care, and when they would see you, they would just light up like a Christmas tree. They would get so excited, and they would say, "Oh, are you my nurse? Oh, so did you go to college?"
So yes, African-American, especially the elderly, and they would always try to get me fixed up.
Right.
Like, "You're not married?
Exactly.
You want to meet my son?"
While some tried to play matchmaker, Cecil and Booker tell me the more serious side of their job, they save lives and they touch them. And while they have each other, they've stayed at Grant Medical because of the rest of the doctors, nurses, and staff. Over the decades, these two nurses have accomplished a lot and they've been promoted. But there's still an ugly side of medicine. They say they thought it would change along with the times, but it hasn't.
And I've actually had patients who's asked to have me taken off of their assignment. I want to fight this through because I want them to understand that I am passionate, caring, loving, and I'm here to take care of them.
That was Darlene Hill reporting, and they're going to be taking care of all their patients for quite some time. Darlene telling us neither one of them has any plans of retiring anytime soon.